the hard thing for me to figure out is sort of what Summer was saying, and Lonnie, of how do we uncouple diagnosis from assessment? Because partly my life is doing assessments that start with the diagnosis, but then really are intended to try to describe the child with a parent and figure out what are we going to do, and an adult. And so it's hard for me to uncouple it, but I think it can be. It's just, what would we trust? And then I do worry about getting lost. I mean, because I saw your note, Marinike, I'm going to mispronounce your name, sorry. But I think that there are very long diagnoses. I'm not even sure they're better. And then there are very short diagnoses, and probably some of the short diagnoses are absolutely right. But what does it do for a family if they come in and see someone who says your child has autism? That's it. Goodbye. Or come back in 6 months and we'll discuss it more. I mean, I think that's a very standard thing. So I don't know. And then I think, Valeria, as we've talked for years, it's the financial aspect of the fact that the ADOS is sold for profit by a publisher, and that is not going to change. I mean, just in making another instrument, the BOSC, that we are making at cost, it is hell, you guys. So if we want it made, it is going to have to be by somebody who makes money, because people are not going to do it. But how do we have it be a reasonable cost? And you and I have tried for years. We need publishers in countries who would do it, who can do it more cheaply, but I think there's no motivation for them to do that. And so, I mean, in Denmark, the Danish Psychological Association has like the working, I don't know what it is, publishing agreement to do it. So they did it, a not-for-profit, and they do it, and they make a Danish ADOS. So that's a possibility, but it does depend on professional organizations being willing to take this on.